All right, hello, and thank you again for joining us. We'll get started with today's session. So I'd like to let you know a little bit about some what we would call housekeeping before I get started on the presentation. So there'll be time for questions specifically at the end of the session, but in addition, my colleague David is here and monitoring the chat box for the next 90 minutes. He can answer any burning questions you might have, which he doesn't think I'm likely to answer during the presentation. We've got a note on the chat box, but I'll just mention that if you experience any technical difficulties, please just exit the session, log back in again using the same code that you did before. We recommend using Google Chrome as your browser for the best experience. So if you've got any sound or visual difficulties with the session, just go out and come back in. And to let you know that the session is being recorded, anyone who registered for the session in advance of today will receive a recording roughly 24 hours after we close. So if you can't stay for the whole session, you won't have to miss out. Obviously, we're hoping you're going to stay for the whole thing, but we do know that sometimes life doesn't make that possible. So you will receive a recording. So thank you for taking time out of your busy schedules to attend this session about the OET Writing test. If you are thinking about applying for the match, OET is something you will need to prepare for in the next few months. And the aim of this session is really to give you the revision guide for the writing test so you can get the information you need to prepare smart and go into the test confident that you will get the score you need, putting a nice big tick against OET so you can move on to the part where you're registering with the ECFMG and preparing for the match. This session is going to focus on international medical graduates who are already studying perhaps at medical schools in the States who need to pass OET medicine as an ECFMG requirement. Your current English proficiency designates you as being native speaker standard, and that's great news for you. But even from this position, you need to know what the test is going to contain and what you need to do to get the score you want on test day. It's no different to any other important life experience. If you go for a job interview, you review and improve your resume and prepare a few answers for questions you expect will be asked. Even for something as simple as buying a new phone or laptop, you would do some research, check out the specifications, etc. And we know that if we walk into something like an interview or important purchase cold, the reality is that we won't be the most prepared applicant for the job, or we'll end up with a device which doesn't meet our needs and we are left with regrets. OET is no different, and it's not a complicated test. We want to reassure you of that, but it does have a set format and a set of requirements you need to demonstrate to achieve the score you want, which is a B grade. While it is testing your English using healthcare scenarios you will be familiar with, don't fall into the trap of thinking, I've got this in the bag, I don't need to spend time preparing for the test. This is a big assumption to take, especially when it's for something as significant as ECFMG recognition and the opportunity to complete the once-a-year shot at the match. Be sensible. You need to know what is expected of you and how to demonstrate it at the very least. By the end of this session, you should be clear about this and ready to go it alone with some final preparation. If you are joining this session and English is not your first language, please do stay. The contents of the session are going to be helpful to you too, and you can cover the language aspects of OET, which won't be focused on here, through the other resources offered by us on our website or our partners via @officialoet on Facebook and YouTube. So let's start by covering off the facts. The OET writing test is to write a letter. You are given a case history about a patient, and you will use this to write the letter as their physician to another healthcare professional. You have 45 minutes for this part of the test, and this includes 5 minutes reading time to read through the case history, and then 40 minutes to write the letter. If you are taking paper-based OET, then you will write your letter in pen or pencil. The choice is yours. But if you are taking computer-based OET, then you will type your letter. During the reading time, you cannot make any marks on the case history, but once the writing time starts, you can circle, underline, or strike out information in the case history if you're taking the paper version, and you can highlight information in the computer version. For ECFMG registration, you need to achieve a B grade, which is a numerical score of 350 or higher in your OET writing result. How are you going to get this 350? Well, there are three things that you need to do. Your letter needs to clearly communicate the information the reader needs to continue care for the patient. It needs to be clear from the beginning why the letter is being written and what is expected of the reader after they read it. It also needs to be organised and use formal healthcare language, which is considered appropriate between healthcare colleagues. So it is more this example on the left than this other example on the right of your screen. And I'll explain why as we go through the session. So let's walk through the approach to take when completing the OET writing test. First of all, let's think about your 5 minutes reading time. The first thing you want to check is who you are writing to and why. This information is provided in the writing task at the end of the case history. If you're taking computer-based OET, the writing task is provided at the end of the case history and above the box where you will type your answer. And you can see examples of both of these on the screen now. So paper-based looks like the example on the left, and computer-based is like the example on the right. So here's an example writing task for medicine. And without reading anything else from the case history, just from reading this writing task, we now know we are writing a letter of referral, or you might be more familiar with it as a letter of consultation or introduction, however you like to think of it. We're writing to a gastroenterologist, and we're requesting assessment for our patient, Mr. Knowles. There are three types of letter you might be asked to write. A referral letter, which, as I've said, you might be more familiar with as a consultation letter, a discharge letter, or a transfer letter. By and large, the final document is the same. The type of letter really comes into play when deciding how to start. It is a referral or consultation letter when you are introducing the patient to a new healthcare professional. A discharge letter is when the patient is returning home or to their usual residential setting. And a transfer letter is when the patient is being moved from one kind of residential care, so for example, from hospital, to another kind of residential care. For example, it could be a rehabilitation facility or a palliative care facility. Here are a couple more examples of writing tasks. And I want you to have a look at them and then post in the chat the answers to the three questions you can see on the screen now. So I want you to tell me what type of letter you are writing, what is the reader's job role, and why are you writing? And I'll just give you a minute for those responses to come through. Great. So yes, we've got some people coming through saying number one is a referral letter. That's great. What is the reader's job role in that example, and why are you writing to them? That's great. I can see, lots of people saying a referral letter. Thomas is saying it's to an endocrinologist and we're writing to manage sugar levels. Excellent. Well done. What about example two? Who are we writing to in example two? A few of you are saying example two is a transfer letter. What's the job role of the person in example two? Lots of you still sending through comments on number 1, which is great. For number 2, I can't see anybody having mentioned the keyword. There we go. Pooja says an occupational therapist. That's right, Miller as well. So number 2 exactly is to an occupational therapist. And if I bring it up on the screen, we can see that number 2 is to an occupational therapist, and we are requesting an assessment of our patient's workplace. Now, number 2 doesn't specify the type of letter it is. A few of you were saying, is it a transfer letter? But remember, a transfer letter is usually when the patient is in some kind of residential care and you're transferring them to another type of residential care. So I said maybe a hospital to a rehabilitation facility. When it's outpatient, it's not usually described as a transfer letter. This is really still a letter of introduction, so we would still class it as a referral letter. You're introducing the patient to somebody new. There's no existing relationship between the reader and the patient specified. So we're asking the occupational therapist to meet this patient for the first time and to assess the patient's workplace. Remember, the case notes are going to give you all the information you need to include. You don't need to be familiar with the work or role of the person you are writing to. You just need to communicate the information they need as per the task that you've been given, the ones we're looking at on the screen. This also means that you are not expected to add new medical information which is not already in the case history, or speculate about the situation using your own medical knowledge or skills. OET is a test of your English, not a test of your medical skills. Adding extra details which have not been given to you may negatively impact your score because it's changing the task which has been set. So now you know who you are writing to and why. I'm going to show you a table of information you want to be able to locate from the case history. The headings from this table will help you to use your 5 minutes reading time wisely and help you make decisions about what you need to include in your letter and what you can leave out. The headings in the left-hand column are the categories of information you need to find, and the right-hand column explains these further for you. So this is an example of how to use the table at the moment. So I'll just run through these briefly. The first one is the patient's name and their date of birth, and make sure when you're writing these into your letter that you copy them exactly from the case notes, spell them perfectly. Then we need to find out who is the letter from, which means what is your job role as the writer, and who is the letter to, what is the reader's job role. It's also a good idea to think about whether there are any existing relationships between the reader and the patient. And this could be between you and the patient, or between the reader and the patient, or perhaps there are no existing relationships. Then, what is the presenting complaint or issue? Or in other words, what is your medical reason for writing the letter, which will be given to you in the case notes? And this is different to the purpose of your letter, which is what does the reader need to do at a high level to continue care for the patient. Noting any medication the patient is taking, which is relevant to this reader and this situation, is also a good idea. But the biggest chunk of information you're going to focus on is going to be the relevant history, which will include things like the background information, maybe their social or medical history, their previous visits to you, and so on. And finally, what future needs does the patient have, and what specifically does the reader need to do to continue their care? So here we've got a set of case notes for that first task that we looked at, which was about Mr. Knowles, referring him to a gastroenterologist. Again, in the chat box, I'd really like you to look at the information headings from the table on the right-hand side of your screen, and just look at those case notes and pick out one or two of those details, type them into the chat box. Perhaps you can find out who the letter is from or who the letter is to, or what is the purpose of writing? What is the patient's presenting complaint? Pick out one or two of those headings and see if you can locate the information and then add it to the chat box. And again, I'll give you a few minutes just to have a look for those information. Sorry, some of you are finding it difficult to view the notes. Perhaps try and minimize the chat on your screen while you're having a look at the notes, make them slightly larger, and then there are some of you obviously who can see them a little bit more clearly. So that's good. We've got the patient's date of birth coming through, his name. I'm sorry, I can't make it any bigger. What we can do is say that this is one of the tasks on our website. So you will be able to look at these set of case notes afterwards if you can't see them clearly now. Peter is saying the reason for referral is for possible pancreatic malignancy. Very good. Mr. Knowles is a new patient of mine. That's great. That came from Joel. Thank you for that. I'll reveal the answers in a second, so don't worry if you're struggling to read. We can just give a few more seconds for those who are sending through information. Toro is saying the patient is taking fluoxetine. There's no existing relationship from Aditi. Sepide says refer for GI evaluation. Very good. Rahul, he originally came with heartburn or indigestion. Excellent. All right, so let me show you the information that some of you were picking out there. And I've added in the relevant history because, as I mentioned, that was going to be quite a big section of information. So if you had the case notes available to you, perhaps for those who couldn't see it so clearly, and you were completing the table, this is what the table would have ended up looking like. So we've reduced all of that information from the case notes into this table, which now tells us the information that we need to include. It also leaves some information from the case history that we haven't got in our letter. And this information we can omit. So things like his marital and children status, his depression and related medication, his childhood eczema, his initial concerns about hernia, plus a few details from the first consultation, and the absence of any relevant family history, because none of those details is relevant for the gastroenterologist, is relevant for the reason that we're writing to the patient today. So it's worth bearing in mind that what the reader needs to continue care is different to what the reader, or you as the writer, thinks the reader will find interesting about the case. So while you might generally err on the side of caution and be tempted to include all the details to allow the reader to make any judgments from it that they wish, here in OET, you are expected to demonstrate you can select information to give to the reader. For this reason, you can expect some irrelevant case notes to be included to allow you to demonstrate that you can weigh up what to include and what to omit, and then prioritize details as a result of your decision. We know this is a crucial skill when working in a healthcare environment, and one which will be valued by your colleagues when reading your written communication. This table is a handy tool to use with any practice task, and quite quickly you'll stop needing to use an actual table, but just remember the headings, which are shown on the left-hand side, to help you locate the information. When you start doing actual test practice, you will have to keep this information in your head anyway during the reading time, but it should help you to feel confident that you have a good grasp of the situation by the time the 5 minutes ends. So let's move on now to writing the letter. So once your writing time starts, it's a really good idea to capitalize on the 5 minutes you've just had by going through the case notes one more time, crossing out anything irrelevant and doing a rough plan using the themes from the remaining information so you feel you have a clear roadmap for your letter before you start writing it. Again, there are some examples on the screen about how you can do this for both paper-based and computer-based OET. The plan can be as simple as how many sections or paragraphs, to use the correct word, your letter will have, and a title for each of those sections or paragraphs. Generally, each paragraph will cover one theme, which could be time-based or it could be topic-based. And examples of topic-based paragraphs include background medical history, complicating social factors, and so on. I want you to understand that there isn't one perfect letter that the assessors use to judge your letter against. You will get a 350 by keeping the reader of your letter front and center of your mind as you write and making decisions on what to include and how to organize and prioritize this information based on what will be clearest to them. So, with this in mind, I'm going to show you some example letters written by candidates preparing for OET for this task that we've already been discussing about Mr. Knowles. And we're going to analyse them together to look for strengths and weaknesses. So here is example 1. I hope this is a little bit clearer for you on the screen. It is a little bit larger. I'm going to give you a few minutes to read it, and then I'll ask you a couple of poll questions. Great, thanks for letting me know. This one's easier to read. That's great. Some of you are coming through with some opinions, saying the eczema is not relevant. Medical is saying it could be more precise. Famida saying non-relevant information included. That's great. So it sounds like you've had a chance to read through the letter. So I'm going to ask you a few questions. So look out in the poll section. I'm just going to launch the first question now. So as the reader, if the situation is urgent, when would you want to be told this in the letter? And you've got 3 options: at the beginning, in the middle, or at the end. If you put yourself in the shoes of the gastroenterologist in this case, but any reader, if the situation is urgent, when would you want to be told this? That's an overwhelming majority, going for 96% at the beginning of the letter. And that's right. If the situation is specified as urgent in the case notes, then make this clear from the beginning, not at the end, like we can see in this example on the screen. All right, next question. As a gastroenterologist, how significant would the results of the FBC and liver function tests be to your understanding of the situation? Do you think they would be critically important, significant, or just quite useful? So have a think, again, putting yourself in the shoes of the reader. If you were reading this letter to understand the patient's current situation, how significant would the results of those tests be to your understanding? A little bit more variation here, but most people are saying critically important. So 64, 65% are saying critically important. So another tip, if the test results, or it could be medication details, it's not always test results, as it is in this case, are particularly significant to the reader and their understanding of the situation, or their ability to continue care for the patient, you need to include them in the letter. Don't use phrases such as per the pathology reports, or the test results are attached in these cases. And one final poll question about this example. As a gastroenterologist, again, as this reader, would you want to know more results were high than just the serum amylase level? Would that be yes, no, or not sure? What do you think? Yeah, overwhelmingly, 97% of you have said yes, you would want to know more than that. So again, don't leave out important details that the reader needs. Make sure you include them within the letter. And then just one other question. Some of you have picked out on this in the chat already. Is it frustrating as a gastroenterologist to read the patient's life story in paragraph 4? So you can see that on the screen. We've got details of his eczema, his depression, he's married with 2 children. Is that frustrating as a gastroenterologist, or is this information the gastroenterologist feels that they need? And again, most of you, over 80%, are saying yes, it is frustrating. So only include information from the case history which is relevant to the reader and the current situation. And the table we looked at to use in your 5 minutes reading time will help you to avoid information you don't need to include. So overall feedback on this task, the letter is generally well written and clear. I have no trouble understanding it, but I feel like I'm reading a story. Everything has been included, and I find this frustrating. The writer could have cut irrelevant details and managed to summarize the important content with fewer words. So let's look at another example. And again, I'm going to give you a few minutes to read it. And once you have read it, again, put your opinions into the chat box. Let us know what you think of this letter. Okay, so Morgan saying, I don't care that he's a management consultant. Griffin is saying, I'd be frustrated if I got this letter. Regina's saying this is better. Rebecca's suggesting the last paragraph should go first. A few people agreeing with that idea. Regina saying the second paragraph is irrelevant. Maria, urgency is again mentioned at the end. Ian, illogical ordering. Sultan saying still not that good. Great, so let's again have a couple of questions about this letter. So here's a poll question. Given the current situation, we know that we're referring the patient for suspected pancreatic malignancy. Are details such as the remedy the patient tried before visiting the doctor or the booking of the laboratory work important details to include? Yes or no? Or not sure? You've got that option as well. This one's a bit closer. It's interesting, but most people are still saying yes, which actually I would disagree with. So what my recommendation is, when historical details have been superseded, they can actually be omitted. So the fact that the patient had tried over-the-counter antacids is no longer relevant because the situation has progressed beyond this. We're now much more concerned about their situation, particularly the fact that a laboratory work and a review was planned and ordered. Those are just unnecessary words that we're forcing the reader to look at. We could summarize much more effectively, but omit those words from the letter. And another question, there are 5 sections in this letter. The first and the last explain the reason for writing and make a request of the reader. And the middle 3 paragraphs cover background information about the patient's first visit, and the patient's appointment today. So which of those 3 topics that I've just mentioned would you say was most important to the reader? So putting yourself again in the reader's shoes, knowing this is an urgent situation. Is the background information about the patient most important? Is the information about the patient's first visit most important? Or is information about the patient's appointment today most important? And we've got another overwhelming response here. 93% of you are saying information about the patient's appointment today. So organize the letter in order of importance to the reader. And some of you were picking this out already in the chats before we started looking at the questions. That the last paragraph should actually have come earlier on because it's more relevant to the reader. You can organize your letter in a number of different ways, as we've already mentioned. So it doesn't always have to be like you can see on the screen now. We've talked about it could be time-based. So when it's an emergency or urgent situation like this one, going from most recent to present day, or if it was a routine case, starting with the first visit and progressing up until today in that order. Or it could be topic-based organization. Perhaps you might have a situation where you've only had one consultation with the patient, so the timeline isn't the most important focus. Instead, you're focusing on different aspects of the patient's situation and care. So overall feedback for this task, this letter is also generally well written and clear, but I am frustrated to need to read the first 3 paragraphs before I find the information I'm most interested in, which is what is happening now, and the fact that the situation is considered urgent by the referring doctor, and I don't get that information until right at the end. So Now we've had a look at some things to avoid and some tips of what you should do instead. I'm going to give you 2 samples which have followed these tips to compare. So here are the 2 samples on the screen. And I'm going to give you 4 minutes to read the 2 letters. And then I'd like you to share your thoughts and any preferences you have for either letter in the chat. So you might like to refer to them as 1 and 2. And let me know once you've had a chance to read through them if you have any opinions about either of them, whether you prefer either 1 or 2. Let me know in the chat. So got a few people saying I like number 1 better. Then we've also got some people saying they prefer number 2. So that's good. We've got some discussion going on. If you have a preference for one of the letters, can you try to maybe explain why you have that preference? Maria is saying number 1 is more concise. Sonia says number 1 goes straight to the point. Some of those who like number 2, do you want to come back and explain why number 2 is your preference? Rebecca's saying, actually, I would like a mix of both. All right. And Bakhtiar is saying both are great. Isabel says 1 is more to the point and 2 is more pleasant. That's an interesting opinion. Lenin is saying the second letter is concise and explained. Santiago, number 2, is shorter and straightforward. So we definitely got 2 camps here. Some of you saying the first option is better, the other saying the second. Mo says number 2 is more organized. Britt Miller says 1 has more detail with the lab results. Amanjot says, I prefer number 2. It omits irrelevant details. Shubham says, in number 1, the values of all the tests are given. You could just say it was high or low. Kurt is also saying ideally a mix of both. 1 is direct, but 2 is more polite and professional. That's great. So lots of really good opinions coming through. So to sort of give you my thoughts on these letters, they effectively cover the same ground, as many of you have been saying, and they're actually here to show you that there's more than one way to write a good letter. So the sample on the left uses 4 paragraphs, the other sample uses 5, but the separation of information into these paragraphs is clear. So remember that the aim of your letter is to, and whether it's going to be successful or not, will be on whether the reader is left with a full understanding of the situation through logical presentation of the facts. So both of these examples, despite their differences, have the merit to achieve at least a B grade. So let's look at how these samples evidence the assessment criteria for writing. This will help you understand what you need to do when you're writing your own letter. So the first criteria that you have to meet is purpose, which is to make sure that the reason for writing to the reader is immediately apparent and it is expanded sufficiently in the course of the letter. So in both of these sample letters, the reason for writing is within the first sentence and the urgency is also mentioned. And later in the letters, this is expanded to request the endoscopy. Now, just pausing here to talk about purpose, we often think of purpose as a circle. So at the beginning of your circle, at the beginning of our letter, we explain at a high level why we are writing to the patient. What is our high level request of this patient? And our high level request in this case is assessing our patient. So we start off with that as the purpose. Within the course of the circle of the letter, we include all of the detail that the reader needs to understand the situation. And then we return to the beginning of the circle by returning to that reason for writing and providing more specific level of detail about our request. So the fact that we've got the endoscopy at the end is actually a nice way of closing the circle, bringing the reader to a sense of completion that they've now understood everything that they need to do and leaving them with the most important request that they're going to have to do on behalf of the patient. The next assessment criteria is content. To score well here, you need to ensure all the necessary information is included and is accurate for the reader to be able to continue care. So when you're using the table we used at the start, this becomes very easy to check. Everything you included in the table needs to be in the letter. And when using your own words to communicate the information, you need to be careful not to change any of the meaning, which would cause a loss of accuracy. You might be concerned about using the exact words provided in the case notes. It might feel a little bit like cheating, but ask yourself this: at work, would you think twice about changing some words on a form into different words for a colleague? Of course not. So it's completely acceptable to lift facts from the case notes, provided they are placed appropriately within your own created sentence. The case notes are just that, they're notes, which also means you will need to add words to make them complete sentences, and when joining ideas together, change words to fit your new sentence. In the two sample letters, details are repeated with minimal changes or additions to form complete sentences from the notes. They have used some synonyms. So for example, they've used raised for high or jaundice for yellow discoloration, but these have the same meaning as the original and so are entirely appropriate. The next assessment criterion is conciseness and clarity. Now, this requires you to summarize the information the reader needs, which includes, but is not limited to, omitting unnecessary information. Again, if you get used to using the table we looked at the start, you will have by default identified the information that is to be omitted from the letter. But this only satisfies part of this criterion. There's also the need to effectively summarize, to be concise. Now, conciseness means to write what you need to without any additional or redundant words. And conciseness in speech and written word is extremely valued by the healthcare profession because it respects the demands on time and gets the message through clearly. So this means not adding learnt phrases as standard to your letters just because you feel they look good, or using overly complex explanations when something simpler works just as well. So it's that difference between example 1, which we looked at a few minutes ago, which was the one that felt like it was telling us a story. It included all of those details about the patient's life history. And the 2 samples that we have on the screen now, which are to the point, they're factual, and they're objective. Then we have genre and style. Now, this one is possibly the most straightforward criterion for you to score well on. To do so, you need to evidence appropriate formal language, which is favoured by the healthcare profession when communicating with each other in written form. And this is something you're likely to know and be really familiar with already. So it's not something you will particularly need to work on. But there are a couple of points to be aware of which you might not otherwise have considered. So one of these points to think about is things like abbreviations and brackets have the impact of making a letter seem less formal. And I don't mean you can't use any abbreviations or brackets in your letter, but you should be judicious about their use. So stick to abbreviations which are more common than the full forms, things like MRI or sorry, it's gone out of my head, a BMI, sorry, or within the specialty of the person you're writing to, and use commas in place of brackets to show the information is additional to the main part of the sentence. We've already talked quite a lot about organisation and layout, and to score well for this criterion, you need to make sure the letter is organised and well laid out for the reader, just as it says. So we've already touched quite a lot on how to organise the information you want to include. Put yourself in the reader's shoes, but also think about these other things. So as well as getting the paragraphs in the right order, you also need to make sure within each paragraph, the most important information starts the paragraph, the next most important comes in the next sentence, and so on. So the paragraph itself needs to be organised in order of importance. It may be useful, like you can see on the right-hand example, to use a time or topic phrase to start each sentence to help the reader know the direction you're taking, but this isn't necessarily essential. The layout aspect of this criterion is completely straightforward. Your letter must be presented as a letter, and this includes things like the address and date, which we can't see on these samples, as well as the greeting and the ending at the end of your letter. Don't throw away marks. This is a final tip about this criterion by not getting the ending onto your letter. So whether you have time to include a closing sentence or not, something like the should you require further details, please contact me. If you don't have time for that, the minimum is the closing salutation, which is usually yours sincerely, and your job title, doctor. It's really, really simple, so make sure you do it. Don't throw away those marks for layout by not having time to do that. The final criteria is language, and as I referenced at the outset, the language criterion isn't something which I'm focusing on in this session, and these 2 examples that you can see on the screen are both absolutely well written. To score well in this criterion, you need to have good spelling, punctuation, grammar, and vocabulary. This is unlikely to be an issue for you as a native speaker, but if you feel there are some areas you need to brush up on, then there are plenty of resources on our website to help you with this. So having looked at all of the assessment criteria, one final thought is that to get your 350 in writing, you need to score highly in all the criteria. Having amazing language and grammar will not carry you over the line if you have made errors with what information to include, or if you haven't properly explained the reason for writing. Having said that, minor individual mistakes in a criterion will not reduce your score substantially. The assessors are scoring your letter from a macro perspective, overall ability to communicate clearly and accurately in a healthcare setting. So before we move into the final section of the webinar, which gives you the tools to assess your current writing and diagnose any weaknesses you want to work on, I'm going to give you a handy list of things you don't need to worry about and one thing that you need to know. So there is no need to diagnose the patient if a diagnosis isn't part of the case history. As I mentioned earlier, you are not being judged on your medical skills, only on your use of English. So if the diagnosis isn't there, you're not expected to make one from just reading the case history. There's no need to make recommendations or add any extra details for the patient's ongoing care, apart from those given in the case notes. So this goes back to the point that the case notes give you everything that you need to communicate to the reader. You're not expected to add your own thoughts, your own recommendations. There's no need to pay very close attention to your word count. And I've seen a few questions coming through David's been answering on chat. If you've accurately selected the information to include, the word count will roughly fall within the guided word limit anyway, which is between 180 and 200 words. It might be handy to have a rough estimate of how many words you write or type to a line. So at a glance, you can tell if you've roughly hit the word limit. But remember, the word limit will only impact your score if you've clearly included unnecessary details, and that takes you well over the recommended 200 words, or you've omitted information the reader needs, meaning you're under the recommended 180 words. That will impact your score for conciseness and clarity, and whether you've included irrelevancy. There's no need to try to show off technical terms or more obscure vocabulary choices. The aim of the writing test is to gauge your ability to communicate information clearly. Set phrases may look nice, but unless they are used appropriately, they can smell really bad, and they can be spotted by the assessors from a mile off as an unsuccessful attempt to impress them. Likewise, use appropriate formal professional language, but don't be tempted to overcomplicate your word choices. There's no need to put the case notes entirely into your own words. You can use some words and phrases as they are written. Remember, though, that the case notes are in note form, and to effectively summarize, you're likely to need to add words or change words and phrases to make them complete sentences. And finally, the one thing to remember, you can use American English spellings and phrases. So both American and British English are accepted as standard by OET assessors. If your language of communication is American English, American spelling is absolutely fine. The only thing we have to say on this for candidates is you must be consistent with your style of writing throughout the letter. So if you are using American English spelling at the start, you need to use American English spelling throughout. The same with British English spelling. So both are absolutely accepted. You use the one that you are most familiar with. So I've got some final thoughts about how you can assess your writing to know how close you are being to test ready at this point. And I'm going to make a handout available now. It will, except I've just hit the wrong button. So just give me a second. I'm going to try and add it again now. Just one moment. We're going to talk about a few different things on the screen for you to look at, and just getting the handout uploaded again now. And it's being shared in the file box. So you should see a red button coming above file. There's a handout in there which covers all the links for these pieces of advice that I'm about to share on it. So after this session, it'll be really easy for you to go and access the information, the resources that I'm going to mention. So click on that handout if you'd like to get some more details about the tips that I'm about to share. So the first thing to do to assess whether you're test ready is to complete a letter. And if you're yet to do a practice OET writing test, then head on over to our website to choose from one of the 4 free tasks for medicine that you will find there. Task 4 is the one we've looked at today, so that might be a good one to start with. Or if you're looking for some more support, task 3 comes with a supportive video going through the case notes and what to think about when planning your letter. Tasks 1 and 2 on the website have no additional resources attached to them, so pick a task that you prefer. Some of you would appreciate having some extra guidance, while others will prefer to go in cold and see what you can do now on your own. It's completely up to you. If you're going to be taking the test on computer, then there's also a medicine version of the writing task available in the computer-based format on our sample test page as well. So you can try out that format. You can also use the sample test to make a decision about which type of format you prefer, whether you prefer to take the test on paper or on computer. You can also choose whether you're going to write your letter under timed conditions like it will be in the test or not. Again, there are some pluses and minuses to this. The benefits, perhaps, of doing it under timed conditions are seeing what you can produce in the 40 minutes allowed for writing, plus the 5 minutes reading time. But the detractors are unnecessary pressure, especially if this is the first time attempting a writing task. It might be more meaningful to see what you produce without a time limit and then work on the time limit aspect once you are more familiar with the task format. So once you have your letter, once you've written a letter, the reader mnemonic will help you to consider if you have done a good job. And there's a link to this article and more explanation about the strategy in that handout that's now available from the file section. So each letter from the word reader spells out a handy reminder of things to check you have included in your letter. Some of you may notice when reading the article in the link on the handout that the contents have a close resemblance to the explanation of the assessment descriptors I gave during the session, and you wouldn't be wrong. They cover the same ground, but in an easy to remember way. For more details on each of the assessment criteria and tips about how to evidence them, please download our comprehensive writing guide, which is complete with examples from one of the sample medicine writing tests. It's a really big document which covers lots of ground in more detail than we've managed to do today. So I really recommend that as a critical resource for all of you to access after this session. For subsequent tasks, so perhaps once you've written a couple of letters, checking your letter against the assessment criteria and the actual descriptors that the assessors use to score your writing against them is a really good idea. Now, it's best to aim for the top in each criterion. Then you can relax on test day, knowing you are on track to getting the score you need. If you look at the top line of the descriptors, you will again see the same themes we've already been looking at in this session and which you've seen examples for in the sample letters we looked at. Finally, to be really certain, you might feel it's worthwhile to pay for some feedback on your writing to get an expert teacher's view, which will give you further confidence that you are test ready or what final areas you might need to do some work on. So we recommend the teachers which are listed on our website and linked to in the handout that is available to you now. And many of them offer writing feedback as a standalone option. So it's worth checking a few of the providers to see which one has the best offer for what you are wanting. So we've come to the end of the main part of the session, and it means we've got plenty of time available to answer questions. Before I open up to start answering the questions, and I can see that David's been very busy in the last hour answering many questions. Before I get on to answering other questions that you might like to ask, don't forget to think about booking your test. It may feel like there is plenty of time now before the end of your end of year deadline. And I've just put the link to booking your test up onto the screen now. Make sure that you are thinking forward planning, how long you think you might need to prepare, or how much time, or when you're going to have a period of time available to prepare. You can always book your test date now for that time in the future. We know that as we come closer to the end of the year and the deadline approaches, places will book up more quickly. So even if you're not planning to take the test for a few months yet, get your test booked in, and then you know your seat is waiting for you when you become when you're ready to actually sit it.